Hello, welcome to another edition of Talking Sports and Fitness with Zeke. I'm Zeke, also known as Mike Zielinski. I'm honored today to have two very special guests. To my left is Sarah Vecchio, who is a Director of Fitness at Body Zone Sports and Wellness Complex. And to Sarah's left is Dr. Randy Yocum, who is Director of Physical Therapy at Body Zone Sports and Wellness. Sarah, you get people fit, and then Randy, you put them back together when they when they start spewing parts, right?
That's right.
Let's start with you, Sarah. I was amazed that Body Zone has over 120 group exercise programs in your studios and also your pool. I mean, that's much more encompassing than most gyms.
Yeah, we definitely have the most in Berks County right now. We have everything from, water walking classes in the pool, to intense classes in the pool, to Les Mills classes, which is very popular for group fitness.
They're very popular right now, aren't they?
Yeah. So we encompass the Les Mills, but we also have some HIIT classes, high intensity training, which is very popular, and studio cycling.
And I guess all that body combat and body pump and all the other stuff.
Yep, we have all that too. So we really have like every kind of Zumba, yoga, all kind of interests for people.
Do a lot of people actually do multiple classes, different
disciplines? Some people will actually do like 3 classes in a row.
Really?
Yeah, because they'll hit like an hour of cycling, and then they'll do a CX Works class, which is a core class.
Yeah.
And then they'll go to yoga to get their stretch. So it's kind of neat. They get the all-encompassed full body everything.
What's your favorite?
My favorite, I teach body attack and body step. I would say that they're my favorite.
I saw that on your website. What's body attack?
It's a high intensity floor aerobics class, fitness class, so to say, and it's lots of burpees and jumps and squats and push-ups and.
Sounds like boot camp.
Kind of, yes.
Yeah. Wow.
Yeah.
We're going to get a little bit more into some of the other things that you do there, but Randy. You and I go back a long way, and you helped put my kids back together after they tore their ACLs playing sports.
A couple years ago.
I want to talk, obviously it's not just athletics, but athletics can beat you up. As you know, you've torn ACLs. You specialize in ACL rehab and prevention, pre and post-operative knee and shoulder, and sport-specific rehab and athletic performance enhancement. In the last 10 years, ACL reconstruction is a lot more effective, and people come back quicker than, say, when my kids had it 20 years ago, or whatever it was.
Actually, it's funny that you say that. Not necessarily. It's gone through.
Really?
No, it's actually gone through some waves of fads, so to speak. There was a very accelerated period a few years back where they were trying to get athletes back in sometimes 3 to 4 months. We had an athlete that went back and played professional hockey in 3 months, but then through research we found out that a lot of times some of these grafts were tending to get stretched out and started to fail. You had a higher failure rate, and now the trend has been going actually to be a little more conservative in the time frame for return to full activity. So if for most patients we tell, if everything goes perfectly and everything goes well, you're looking at about 7 to 9 months until you can plan to return to sports activity. And in high impact sports like basketball, soccer, football, oftentimes it's really, we like to push them back to closer to a year till they return to full participation. And you'll see that even at any level from pro to youth. Even the pro athletes, with everything that they have, in front of them for rehab, that you won't see them back until the following year. It's usually a good full year till you see them. And then even after that, it takes them a few months until they're back to close to 100%.
What is it with some guys come back and ladies come back better than others? Is that because meniscus issues or other ligaments might have?
Yeah, it's often multifactorial in that. Some of it is that their level of fitness before the injury, and then also if they have any other issues, like you said, maybe a chondral lesion or lesion to the articular surface, or a meniscus tear, a meniscus repair. So it's dependent on a lot of those type of factors as well, as you said.
Why do so many people have ACL issues? It's amazing. I mean, almost every Sunday in the NFL, and it's usually it's not always non-contact, but a lot of times it is non-contact.
Yeah, it's non-contact. And part of it there has been a trend to more ACL reconstructions, and a lot of that has to do with the level of participation of the female athlete. We have a lot more female athletes now participating in sports compared to even 10 years ago. And the female athlete is about 7 to 8 times more likely to tear their ACL than their male counterparts. So, we see a lot of soccer, tears in soccer or volleyball, basketball, especially
Does that
for
have
girls.
anything to do with the menstrual cycle?
That is one of the factors. There's quite a few factors that cause them to be more likely to tear their ACL. One can be, actually when they're ovulating, a hormone is released that actually relaxes the ligaments. The same hormone that's released during delivery. So at that stage, if it's that time of the month, then they can be a little more likely to tear their ACLs. But a lot of it has to do with their actual alignment of their knee joint.
Yeah.
The female athlete tends to have a wider hip compared to their knee angle, and that often is the big factor, I think, that causes them to be more likely to tear their ACL.
Of course, it's best to prevent it. What are some of the, because you also work with prevention.
Correct.
It's just a series of exercises to strengthen surrounding muscles, your quads, your hamstrings, whatever, right mechanics? Or
Correct. Right mechanics, properly warming up. We put together a very good pre-activity warm-up that they'll do. But really working on a lot of single leg exercises to control the hip and the angle of the knee in a single leg stance, which a lot of times the non-contact tears occur when planting that foot.
Yeah.
And changing direction, decelerating and changing direction. So we do a lot of those types of deceleration, eccentric control type exercises, but we really do a lot of the work on the hip, controlling that hip rotation that occurs in that that type of cutting injury. So we do a lot of single leg dynamic exercises.
Now, Sarah, obviously different age groups, you probably tailor your individual training for someone. Obviously the best way to burn calories is those high intensity workouts, go real hard, relax. But, some people, 50s and 60s, especially with some physical limitations, can't do that. So do you adjust it?
Oh, yeah. Yeah, we make sure, if you're talking just the personal trainers, they do like an evaluation, and we kind of sit with them to see what kind of level they're at. And then we would just tailor it perfectly to what we find is that the level that they want to be, including any ailments or injuries they might have or anything like that.
Now, you read things sometimes, you wonder, like I've seen articles where they're saying, they're proponents of high intensity, and they're saying basically, if you're doing a moderate on a treadmill for 45 minutes or whatever, it's better than doing nothing, or the bike, but essentially you're wasting your time. Is that an overstatement?
It's an overstatement. Yeah, because there's actually so much to do with your heart rate. And and how what kind of zone you're working in. Doing something for 45 minutes is excellent for your heart, and almost keeps you at a point where you're in your fat loss zone in the lower heart rate versus the high heart rate from high intensity
so the
training.
key thing is get your heart rate going somewhat. Right?
Oh yeah, it's extremely beneficial, and it's important for your heart too. And any exercise is better than nothing. So I definitely encourage. Start small and build up.
and weight training can keep your weight down too, right? Because muscle sometimes burns fat after the workout.
Yes, actually the more lean body mass you have, the higher your metabolism will be. So if you're struggling with weight loss, strength training has so much to do with how to get your weight down. If you're just doing cardio, you almost feel like you can't go past a certain point because you don't have that lean mass.
Do you do a mix of like free weights and machines?
Yes, it's really like the perfect mix, which is cool with our training department, personal training, and our group fitness. We can do cardio classes or strength classes like body pump, or they can lift with a trainer on the floor and do a cardio class. So it's kind of a good
and it's
mixture.
good to have a trainer even like if you're not familiar with machines, because I think it's a myth. Obviously you have to have the right technique with free weights, but if you're not comfortable or know what you're doing with particular machines, you're probably doing something to harm yourself, right?
For sure. We always want to make sure that someone would, see a trainer about learning how to do the machines and sitting properly, because they can definitely produce some good injuries from that. So,
Yeah, that's the downside of sports. Well, speaking of that, Randy, sports-specific rehab and athletic performance enhancement. So you specialize in that, where you can take hopefully a young kid, but whoever, what age, and you can train them so they make them better athletes and prevent. So what are some of the things you do?
Well, we do the first part of the question, the sport-specific rehab. Whatever their sport is, I make sure they have a good understanding of the biomechanics behind the sport, what their body needs to be able to do to perform that sport, and then we tailor their physical therapy program to get them to that point. So if I have a baseball player, we'll take them through and get them to what we call an interval throwing program on their return back. So make sure that it's directed and it's sport specific. So the type of strengthening and conditioning that we're doing for that athlete is specific to the demands being placed on the athlete in that sport.
You have to work with even older guys or ladies, golfers, because
all
of
the time.
The torque it puts on your back.
Yeah, I really, that's another area I really enjoy. Is the recreational athlete. We treat a lot of recreational athletes, and it's very rewarding because they still love these sports. They want to be able to play, so we'll find ways to try to help them back safely through their proper strength and conditioning program or the rehab, whatever is necessary. But it's an area that is very rewarding, actually.
So you obviously have a lot of expertise in a lot of areas, right?
I try. I've been it's ongoing for many years, but sports have always been my passion as a previous athlete. So it's been a way for me to stay involved in the athletics and be around that. It's just a fun crowd.
And how about you, Sarah? I mean, obviously you've always been into fitness as a gymnast and doing this for, about 14, 15 years?
Yeah, I mean, I studied kinesiology in college, so it's the study of human movement. I really wanted to do something with the body. Starting as a gymnast and everything, I knew it was my passion to just fitness and muscles and everything. So
your kids are very fortunate. And I know Randy's sons have grown up and they're college football players and doing very well. And your kids are younger, right?
Very young.
But they're going to have all the proper training, right?
They are, yep. My husband's a football coach, and
Let Mifflin, Doc Vecchio, and Vecchio, and Mifflin had a really nice year this year.
Yeah,
sure did.
Yeah.
You have boys or girls?
Girls.
Oh, so you don't have to worry about when you're going to let them play football.
No, no pressure.
Okay, we're out of time, but anyway, please check out the website on Body Zone Sports and Wellness. They have tremendous training opportunities with Sarah and all her programs. And if you're having physical issues, I know from personal experience with my sons, Randy Yocum can really do a great job in helping you out. And don't forget to like us on Facebook and subscribe to the People Chronicles channel on YouTube. Take care.
These stories are made possible in part by Spring Ridge Financial, Heidelberg Restaurant, Queen City Restaurant, Breath Homes, and PJ Willahans.